Hello, and welcome to this presentation about understanding type 2 diabetes, the symptoms that we need to look out for, especially if we are as yet undiagnosed, and how we diagnose it. I'm Neil, I am the founder of Diabetes Solutions, and I came up with the concept of these short videos to help you to understand the basics of the topics that we discuss in around 5 minutes or less. If you find this video interesting, if it helps you, please do like it and please subscribe to my channel, as that will help the channel to grow and reach and help more people. So, what is type 2 diabetes? Type 2 diabetes is a metabolic condition that affects the way our bodies process glucose. Glucose is an important energy source for our cells, and with the use of insulin, we move glucose from the blood into those cells for energy. Type 2 diabetes is the most common form of diabetes. It affects hundreds of millions of people around the world, including adults, but increasingly, sadly, children as well. And around 9 in 10 people who have diabetes will be type 2 diabetic. Now, whilst genetics can play a part in the development of type 2 diabetes, certainly from my experience, lifestyle factors have a bigger impact. So, your diet and your lifestyle will impact whether or not you develop type 2 diabetes far more than genetics. So, what are the symptoms that we need to look out for? Increased thirst and frequent urination. So, constant thirst and going to the toilet a lot, particularly at night, is a really common symptom. Increased hunger because the cells are not receiving the energy that they need, and so they send out signals that they want more energy, and so you constantly feel hungry. If you have unexplained weight loss without consciously trying to lose weight, that can be a symptom as well. And also fatigue, for the reasons we mentioned, the cells aren't getting the energy they need, so that leaves you feeling tired a lot, which can obviously impact your quality of life. Other symptoms include blurred vision, so intermittent blurred vision that kind of comes and goes, sometimes in a fraction of a second. That can be a symptom. And also cuts and bruises and sores that take longer to heal, particularly in the feet, on the skin, and in our mouth, in the gums as well. So if you can identify any of those symptoms and you've not had a blood sugar check done, certainly in the last couple of years, then I encourage you to maybe go and get one done. We'll come on to how we do that in a moment, because you may be one of the millions of undiagnosed type 2 diabetics around the world. And trust me, ignorance is not bliss. And if you are a type 2 diabetic, but you don't yet know it, you need to deal with that. So what are the risk factors? Carrying too much weight. If you're overweight or you're obese, yes, without a doubt, it increases the risk. That said, you can be of a so-called normal weight and develop type 2 diabetes. I have clients who are of a normal weight and they are type 2 diabetic. But without a doubt, if you're carrying too much weight, then your risk factor is higher. If you're very sedentary, if you don't do much exercise, then that can increase the risk as well. And as we mentioned, genetics can play a role in the development of type 2 diabetes. If you've got a parent with type 2 or a sibling with type 2, that can increase your risk. But in my opinion, your diet and your lifestyle are exponentially more important in the development of type 2 diabetes than are genetics. If you're older, if you're in your 40s or 50s, that can increase the risk as well. We naturally put on weight as we get older and we become more sedentary, which can lead to the development of type 2 diabetes. And also, if you've got high blood pressure and high cholesterol levels, that can increase your risk of developing type 2. And if you've got high cholesterol, high blood pressure, and high blood sugars, you have this condition called metabolic syndrome. So how do we test for type 2? The most common test is a fasting blood sugar test. So you fast overnight, drink water in the morning, go and have a blood sugar check, and your doctor can give you, and this is normally a finger prick test, and it'll give you a good idea of where your fasting blood sugar level is. If it's below 7, then Happy days, particularly between 4 and 6, is ideal. If it's above 7 as a fasting test, that is an indicator of type 2 diabetes. A HbA1c test, you might have heard of that. That's the average over the previous 90 days, 2 to 3 months, but generally 90 days. If your HbA1c comes back and it's between 42 and 47, that's pre-diabetic. If it's 48 or above, you are in the diabetic range. And actually, the HbA1c test for non-diabetics is actually quite a useful test, as it will give you that average over the previous 3 months. And less frequently used, but occasionally used, is an oral glucose test, where you're asked to drink a specific sugary drink, and then 2 hours afterwards you're given a blood sugar test, and if that's above 11, then you are considered to be in the type 2 diabetic range. But as I say, the most common one is the fasting blood sugar check, and you can actually do that at home with a home testing kit. They're not very expensive. They're quite easy to use. So why should you be diagnosed early? Why should you pick this up if you can detect some of the symptoms? Because intervention is really important. Type 2 diabetes damages virtually every system of the body. So if you have to go on medication, if you have to make lifestyle changes, dietary changes, then the sooner you do that, the better, because it can lead on to some pretty unpleasant conditions. It can damage the kidney, it can damage the kidneys, it can damage the cardiovascular system. It can have an impact on your brain. There's a big link now between type 2 diabetes and Alzheimer's. And type 2 diabetes is the leading cause of foot amputation, certainly in the UK, because of the damage it does to the nerves. So yes, prevention is better than cure, without doubt. But equally, if you are on that road, if you have got it already, the sooner you know about it, the better, because you can intervene and do something about it. So what can you do to prevent it in the first place? And what can you do to manage it, potentially reverse it if you've got it already? Healthy eating, so lifestyle changes, eating whole, natural foods is important. Exercise is important, so regular exercise as much as you can do within your own limitations, and obviously associated with eating healthy and exercise. If you are carrying too much weight, then losing weight is also really important as well. If your doctor gives you medication, then take that medication. I did write a medication guide, actually. I'll put the link in the comments section. You might want to download it. It's completely free of charge, and it covers all the major types of medication, what they are, what they do, how they act on the body, how they work in conjunction with high blood sugar levels, and also what the side effects are as well. So please do download that if that's of interest to you. Regular monitoring, so keeping on top of your blood sugar levels at home with a glucometer, and regular checkups and HbA1c checks done with your doctor or your healthcare provider, and find out more about it. Education is really important. Learn about type 2, learn how to manage it effectively. If you want to, find ways to reverse it. Attend education sessions, webinars, workshops, those sorts of things. And some people find that joining support groups is actually quite useful in being around people who are going on that same journey as you are. If you want more information, please do check out my book, The KISS Plan, 3 S's, Smart, Simple and Sustainable. It took me 3.5 years to write this book. If you're a type 2 diabetic, it's an invaluable resource. It can really help you. And if you're not a type 2 diabetic, actually it's got some really good tips in there to improve your health and obviously help you to prevent becoming type 2 diabetic in the first place. The website address is www.the-kiss with 3 S's -plan.com. It's available on Amazon, Kindle, paperback and hardback, and you can also get the PDF copy via my website. And my website address is diabetessolutions.co.uk. I put together a knowledge hub on my website, loads of information there on pre-diabetes and type 2 diabetes. Please do take a look at it. You'll find it really helpful, I am sure. You'll find details of webinars that I'm putting together at the moment and I'll be launching over the coming weeks and months. You can book a support call with me for free if you want to. And as I mentioned, I've got lots of guides and things that you can download completely free of charge. And please do follow me on social media: Facebook, X, Instagram, LinkedIn. I will put some links in the comment section. And I generally post every day with lots of hints and tips about pre-diabetes, type 2 diabetes, and improving your health in general. So thank you for watching. If you like the video, if it's helped you, if you found it interesting, please do like it. It helps the algorithm, apparently. And please do subscribe to my channel. Going to try and do a couple of videos a week on the topic of prediabetes and type 2 diabetes. And you'll be the first to hear when I upload them. So thank you again for taking the time to watch my video. I hope you found it interesting. If I can help you in any way, make contact with me. And until next time, stay well.